Thank you, Dr. Al-Hajri. Now we're going to be with Dr. Ahmed Al-Mahrezi, AGU graduate 2016, completed the internship program in the Sultan Qaboos University Hospital in Oman in 2017. Currently a surgical resident in the German board, working at the SRH Hospital, Karlsbad Langensteinbach Hospital in Germany. So with that, I ask that you give your full attention to Dr. Ahmed Al-Mahrezi.
Assalamu alaikum. Thank you for having me. May I share my screen now? Yeah, my name is Ahmed Al-Mahrezi. I'm surgical resident, the German board. I'm happy and glad to give this talk about the German board and how to apply and how is it structured. So let's get started without further delays. So this slide is really subjective and it's only based on my opinions, the pros and cons. The pros about the German board is actually it's high reputation, high standards, that's very well known. And what attracted me the most in the German board is the possibility to get the specialty that you want, actually. I've always wanted surgery, and compared to other countries, the matching process, I was not a big fan of it. So, yeah, this was a very attractive point for me. Learning by doing is actually you get involved, you'll be part of the surgical team, and as a teammate, you will be handed as the same amount of work as any of your colleagues. So you will be doing as many, you'll see patients as many as you can. And this is a very interesting point, which is no sponsor needed, which your salary and fees will be covered by the hospital that you work at. Availability of learning material, well, when people start to think, okay, I'll do my residency in a different language other than the English language, they think that maybe the material would be less, but in Germany, they actually translate all other international books to the German language. And as an AGU student, you should be able to use both the English and German textbooks. Even there are some German authors, they have some really great textbooks. And you could also conduct researches in both English and German here during your residency. A plus thingy to the German board, you will be health insured, and also if you plan to stay after your residency program here in Germany, your retirement is also covered if you want to stay and retire in Germany, as you will be paying some taxes and they will cover such insurances. As cons, as I said, they are subjective. Some people would not see the German language as a con, but as learning any other skill, it would take some time. And learning the German language actually takes some time, and there is no way around it. Basically, if you can't speak German, you cannot start your residency here. The second con is it's highly depending on your team's orientation. Meanings of that, if you're doing your residency in an academic hospital, in let's say an orthopedics department where your head of department or the professor you're following is subspecialized in only one joint, like the knee or the vertebral column, you'll see mainly patients into that subspecialty. There's nothing wrong with that, but to spend all 6 years of your residency in that subspecialty is actually not very well recommended. So rotating between hospitals is what I recommend. Okay. And so how to apply? I've made this presentation as if telling myself, if I had to start all over again, starting today, here are some oversimplified steps, if I may say, to actually summarize what I did. Starting with university recognition, it's a very important step. If your university that you've graduated from is not recognized in Germany, then please either contact this official authority. I've put a link here, and you can contact them. If it's absolutely not recognized, then you may consider other options for you, because obviously Germany would not be the optimal option. And note that recognized doesn't mean equal. I will elaborate more on this point further on in my presentation. And the second step would be getting your official papers ready. Some people would underestimate this step, but starting today, you could collect your papers and really stamp them in the Ministry of Foreign Affairs with the so-called apostille stamp, which is recognized worldwide. And why is this important? Because German system is based on bureaucracy, in Arabic al-birokratiya, where everything has to be included in a official or an original document that provides that. And in this step, I struggled the most because I didn't have all necessary papers at the beginning. I didn't know much about it. For example, a police clearance, the second point, the second paper. I didn't have a police clearance from Bahrain, even though I'm not a Bahraini graduate, but in every country that you lived or studied at, you should provide a police clearance. And for the sake of the equality, it's good to have a university curriculum that's personalized with your name and date of graduation. And another important document, the internship certificate is not enough after finishing the internship. You should provide also a document that states that you are now not a medical student anymore, but you are what's it called, an official doctor, and finished your academic phase in the university studies. Okay, moving on to the third point, which also you could starting today, is learning the German language. There is no other way around that. As I mentioned, there is you cannot do your residency here in English. Basically, the required level in general language in most states is B2 level, and in medical language is C1 level. The levels are from A1, A2, B1, B2, and then you have C1 and C2. C2 means that you speak it natively. That's a challenge, and it's not required for many people. So how to start learning the language? You do it at your own pace. Either you take the courses, or you want to do it online. What I did, I took online private courses using Lingota. It was one-on-one feedback, and it was really flexible because I was doing it through my side by side while I was still studying for the MD and during my internship. So moving on to step 4 is by the level of B2 and general language B2, you should be confident to do your to write actually your CV and cover letter in full German. It has to be full German. A good tool to use that and formulate your CV would be lebenslauf.com. I have it here. It's like the programmed website that has all necessary by European standard CV. And the cover letter is as important as your CV, where you have to mention why are you applying this specialty, and how far are you to get your approbation, which is required to start your residency. More details into the slide, but for the sake of time, I'll skip that. Then step 5, applying for a residency position. You have your papers ready, you have your CVs. There are two different ways to do it there. Either you initiate a contact by yourself, you contact the department or the professor and his secretary using the official websites. Like in Germany, a big positive side, like every hospital, every university hospital has their own website, and you can easily approach any department, usually email them. If they have vacancies, they usually put some advertisements in their website or even in magazines. like Ärzteblatt, which is a very well-known magazine for doctors that also shows the openings for residency programs. And the second way that I didn't personally use, but other people recommend it, is to approach headhunters, where there are companies that they will look for an opportunity for you, and they will contact the hospitals for you. They're absolutely for free. And once they find a spot for you, they will contact you, and the hospital actually should pay them, because it's a win-win situation. You need a residency position, and the hospital needs a doctor because of the huge lack of doctors in Germany. So step 6, at this stage, you should be in Germany for the job interview. Back then, I'm not sure about the pandemic time now, if some hospitals have modified this to so virtual interviews. I haven't done that, but most of my interviews were face to face and took place in the hospital itself. What's good about this, usually the hospital that invites you for a job interview, they cover your excuse me, is someone wants to ask a question or something, or should I just go on? Yeah, the job interview usually it's covered by the hospital fees, the hotel and your transport. Like, let's say if you're taking the train or even taking the car, they will cover your transport. And if you were at this point in your homeland, I would recommend applying for a job seeker visa using the letter of invitation for this job interview. It would help you and it will ease the process. Why job seeker visa? Because you are not a student, you're applying for a job, and it gives you enough time to go through all of your interviews that you got accepted at, and where it's easier to get. And then in the interview, you should expect general questions like, how is your trip? And so on. And it's all full in German. So they usually test your language level and communication skills. And some interviews I got asked medical questions, like, for example, they handed me some ECGs and I had to give the diagnosis on them, and some x-rays and so on. So you could expect anything in a job interview. After getting accepted in the position, after the job interview, the human resource department, usually in the hospital, would tell you which authority to approach for two things that you still need to start your residency, which is passing the German medical language exam, which is called die medizinische Fachsprachenprüfung, and the official medical license, the approbation or the approbation. And here, approaching this authority, you would need all the papers that were mentioned in step 2. And here's a minor difference between the German states. Like, for example, in the state where I'm currently at, Baden-Württemberg, they would give you a limited job work permit for 6 months before even passing these 2 steps. But they would tell you that in these 6 months, you at least need to pass the medical language exam to get it like prolonged to maximum 2 years. But in other states like North Rhine-Westphalia, you would be asked to pass both steps before starting to work, or at least the medical language exam. So once you apply, you get I would recommend passing the German medical exam first, because you will be able to start working. Starting to work would increase your self-confidence, and also you will start earning your salary, which would support you even, and makes it easier for you to settle down and in Germany. So what is the German medical language exam? It's a one-on-one exam. It's like the clinical exams. The aim of this exam to actually see the level of your communication skills with your patient, with your fellow doctors, and how well can you write an admission summary. I used an e-learning website. I've listed it upwards. And the exam is in 4 parts, like the patient-doctor talk is like history taking, then documentation, then doctor-to-doctor talk is like presenting the case. And after that, there is a small section, takes 10 minutes, the medical terminology, die medizinische Fachbegriffe, where you'd be handed a list of terminologies in Latin and in German, where you have to translate between them. Like, for example, liver diseases in German, what do they stand in Latin? Like hepatitis for a liver infection and so on. It's basic knowledge. As an English graduate, if you did your studies in English, it shouldn't be that much of a challenge. So moving on to step 9, after passing this exam, you should be able to start working. But note that without the approbation, it would be recognized as work experience, and you'll be paid for it, but it wouldn't count as residency time. The reason for that, because the job permit is limited, the Berufserlaubnis is limited, and you should be only working under supervision. You cannot do on-calls and so on. So that leaves us with the last step, which is the approbation itself. You can get it with 2 different methods. Either you pass a medical knowledge exam, which is an MD level exam, but in German. Again, the German would be the obstacle, not the medical knowledge, because if you graduated with your MD, you should be able to pass this exam easily. It's usually either medical, internal medicine, or surgical case, where you have to take history and present and answer questions like the clinical exams that we used to have in the MD phase. And the other way to do it is to compare the medical curriculum of your university and one of the universities in Germany. I went for the curriculum topics comparison, and it was equal. They basically compared the AGU curriculum with the curriculum in University of Heidelberg, and it was equal in the hours and topics that we've studied. There was much of difference. But what happens if you went for this step but it wasn't equal? Then it would be recommended for you that you do the exam anyways, which is the medical knowledge exam, and you will have enough time to prepare for it since you started working, and hopefully you will pass that one as well.
Thank you, Doctor. Thank you so much.
I have 1 minute, right?
I guess yes, your last.
Okay, so yeah, I'm almost there. So how is it structured? Straightforward. There's a logbook. You could look it up here in this link, and you should collect 250 CME points. After finalizing these 2 steps, you could apply for an exam at the end of your residency, which takes 5 or 6 years. And then passing the exam at the end of the residency would grant you the specialist at where you did your residency at. This is a copy of as an example of the logbook for orthopedics and trauma surgery, Orthopädie und Unfallchirurgie. It's like, as an example, it takes 72 months, and you see where you should do 48 months in orthopedics, 6 months in emergency, 6 months in ICU, and 12 months in any other sector. Here's also that you'll be recommended to do a minimum number of operations, like, for example, shoulder operations, 20 operations and so on. You have to complete this in your logbook. And as I said, in CME points 250. And the last, the most commonly asked question is the salary. I'm sponsored, how much money will I get? You'll see at the furthest left column as assistant arts, which is the name of the resident doctor. You'll be at the first salary, the most basic salary that you will get is 4,600 euros. That's before taxes. After taxes, you would get almost 3,000, but with on-calls, you could, at the net cause effect, around 4,000 again, as a basic minimum salary. But with every year, as you advance, it increases. Like, for example, once you reach year 6, you'll get 5,900 and so on. So with that, I conclude my presentation.
Thank you, Doctor.
Should I say thank you, or in German, Dankeschön.
Thank you so much. Have a nice day.
You're welcome.